Start us out by just simply describing what does it truly mean to be metabolically healthy?
Yeah. Well, first of all, I think that was a great lead in. I mean, I think it is astronomical the level of metabolic dysfunction that we're seeing in the Western world today, especially the United States. We're dealing with 88%. Actually, this came out of your state at UNC. Um, a study just about a year and a half ago showed that 88% of American adults have at least one biomarker of metabolic dysfunction. So we're in the place now where it is almost inevitable as an American adult to have metabolic dysfunction. And what that means, I mean, that term, it gets used a lot right now, but I think if you asked 10 people on the street, what does metabolic dysfunction mean? They'd probably all say something different. It's a little bit nebulous. So I think breaking it down, what is it? Metabolism is the set of processes in the body that convert food to energy. That's really what metabolism is. We eat, about literally a metric ton of food per year. It's crazy. And all of that, the purpose of that is to be converted to energy and to be used as a building block in our body and to be used as sort of a chemical messenger system to tell our cells what to do. But that energy piece is what metabolism is. We convert that substrate to a form of energy that our cells can use. We have trillions of cells. Every single one needs energy to do the cellular processes to function. So our eye cells, they need energy to function. Our ovary cells, they need energy to function. Our brain cells need energy to function. They all need it. And what's happening is that our modern life, our industrialized chemical food that we're eating, the chronic low-grade stress that we're under, the chronic low-grade sleep deprivation that we're getting, the sedentary behavior that is just so normal and in our everyday lives that was so abnormal about 100 years ago, the 150 pounds of refined sugar the average American is eating versus about 100 years ago was 1 pound. So 150 times the amount of sugar. All these things about modern living are not normal, and they're totally breaking our metabolic processes. They're getting hijacked by this way of living, and we are no longer efficiently producing energy from food. That's fundamentally what metabolic dysfunction is. And the reason it can show up as so many different things, it's like the great masquerader. It can look like almost anything. The reason that 9 out of 10 of the leading causes of death in the United States are in some way related to blood sugar, either caused by blood sugar problems or worsened by blood sugar problems, is because this is a core fundamental pathway that our modern lifestyle is just stomping on. So what metabolic health means is that you are doing those processes efficiently. Your body is supported through everything you're eating and the way you're living in a way that our cellular machinery, our metabolic processes are just efficiently producing energy for our cells without undue byproducts that are causing us harm. And our cells are able to live and thrive and do what they're supposed to do normally. When you have this sort of energy mismatch, this essentially what we would call metabolic dysfunction or ultimately insulin resistance, the downstream hormones are problematic. You get the cellular dysfunction and then you get tissue dysfunction, and that's what symptoms look like. So there's, if this is showing up in the ovary, it could look like polycystic ovarian syndrome. If this is showing up in the brain, it could look like Alzheimer's dementia. If it's showing up in the liver, it looks like fatty liver disease. If it's showing up in the vessels, it looks like heart disease or erectile dysfunction or retinopathy, all vessel diseases. If this is showing up, in any organ, essentially, it's going to look like something different. All those conditions I just mentioned are fundamentally a metabolic disorder. PCOS, polycystic ovarian syndrome, insulin resistant of the ovaries, number one cause of infertility in our country, fundamentally a metabolic disorder. So you have to think, I think, about like metabolic dysfunction as the trunk of the tree of all these branches that are actually quite connected. And metabolic health being the trunk of the tree of really just feeling well kind of all over. Unfortunately, our healthcare system, as I know you know, does not see that tree. It does not see a tree with a trunk that is the same thing with all these things branching from it. It sees them all as separate trees. Like erectile dysfunction is one tree, and depression is another tree, and dementia is another tree, and heart disease is another tree, and we have to treat them separately. But that's not actually really the way it works. Fundamentally, they're all linked by this core process that is totally hijacked by our modern diet and lifestyles, which is not normal. It's totally new. And we really have to get back to dialing in those dietary and lifestyle habits if we want to really create a healthy tree.